Does MD degree significantly influence the growth, designation, or leadership roles in clinical research, sir?
No, definitely not. Your MD is nothing to do with your either designation or growth, or maybe when you become a CEO or when you become a vice president, if you are considered yourself as a doctor or you are MD, then you will be slightly better respected. But definitely the advantage here is who enters early. If you are wasting 3 years as an MD and same your classmate has joined 3 years prior, this your classmate who has joined 3 years prior will have more advantage than compared to you.
So it's more of experience matter, right?
Experience, yeah.
So another minute question: how important are certificates like ICH, GCP, and CRA training or PG diplomas in clinical research, sir?
See, all these trainings, ICH, GCP, PG, diploma, these are basically to enhance your knowledge. Certificates doesn't have any value in clinical trials or any corporate world. If you are a guy who has passed out from IIM or IIT and you have less knowledge, it doesn't matter for them. In clinical trials or any corporate job, your skill sets, your knowledge, your experience, how you deal with the people, whether you are useful to the organization or not. Degrees doesn't have or papers doesn't have any value. But you have completed ICH training, you have certificate, it doesn't value. But you have ICH knowledge, that values more than having the. No one will ask you to show me your certificate.
Right.
Whatever certificate you have, no one will ask you. When the situation arises, do you have the knowledge, do you have the experience, do you have the competency, do you have the knack of coming out of the situation, making the situation better, and are you an advantage with that knowledge to your company? Is your company revenue is increased, or you are adding value to the company, is more important than certificates. Two guys, one guy have certificate, one about ICH, one guy have knowledge about ICH. So, the guy who has only certificate is not going to work, it is zero. This is 100. Who has knowledge is 100, knowledge without certificate is zero, not even one.
So it's more of practical kind of things, or clinical research, or it's theory related, according to you?
Both. See, theory related are there, practical related are there, but here is how useful you are to the company. It is not like some government job where whether you do the work or you don't do the work, you are paid. No. If you want to grow, you have to perform, you have to put your hard work, you have to put your smart work, you have to always update, you have to venture into new, anything new comes, you have to, you should be like water, you have to go whatever is available. You cannot say I'm rigid, I will not move, I will I will sit here only, I will do the same things. Every year technology changes, every year priorities changes, everything is going to change. You should be so fluid, so adaptive, so that you can go into any corner, nook and corner of clinical trial. It is more your usefulness to the organization rather than your degrees.